Good evening, everyone. So, good evening. Sir.
Hi, good evening. How are you?
I'm fine, sir. You?
I'm very well. Very well. You're welcome.
Thank you, sir.
Um, just putting a few things together. We'll begin soon.
Okay, sir. Thank you, sir.
Good evening, everyone.
Good evening, Mrs. Akudike. Good evening,
How are
Mrs.
you?
Faye. Welcome, ma'am.
Thank you. Thank you. God bless you.
God bless everyone.
God bless
Welcome,
you
ma'am.
all.
Okay, it's okay. Good to see you.
Wow, it's been a while, ma. Welcome, ma.
God bless you.
Bless you too, ma. Welcome. Good evening, Prof.
Good evening, everyone. Just give us a bit, maybe 5 minutes. In 5 minutes, we shall begin. In 5 minutes.
Good evening, sir.
Good evening, everyone. You're welcome. Thank you for joining us again. We're hoping that this also is another great evening for us. But just please give me about 5 minutes to sort something out. I'll be right back. Thank you. Okay. Um, Good evening, everyone. Welcome again to another night in our 5 day or 5 night workshop, I should say. Welcome to day 3 of our workshop, and in what promises to be one of the most powerful sessions in this series. Uh, Tonight, we are not just hosting a lecture, we are bearing witness to legacy. Our speaker is a man whose name is woven in the fabric of alternative medicine in Nigeria. A former president of the Nigeria Council of Physicians of Natural Medicine, a visiting professor, a seasoned healer, and a pioneer of clinical magnetology in Nigeria. Um, he is also the provost of our very own college, Cyrillic College. He is the founder of Cyrillic Holistic Hospital, and is a man who has helped thousands of patients walk, speak, and live again after conventional medicine gave up on them. Tonight we have Professor Cyril Omisande, who opens up his practice and his story. He will be sharing unforgettable patient cases, powerful healing strategies that he has employed over the decades, and the wisdom of over 30 years of practice. Prepare to learn, prepare to be inspired, and most of all, prepare to see what healing looks like in practice, not just in theory. Because I believe in the past 2 nights we've been discussing in theory, but tonight I believe we get to hear stories of how these theories have occurred, this event. And please, with your full attention, let us welcome Professor Cyril Balade Omishande. So thank you very much for everyone. The floor is yours, sir.
Yeah. Good evening, everyone. Yeah. Hello. Good evening, everyone.
Good evening,
Good evening,
Prof. You're
sir.
welcome.
Good evening, sir.
Yeah. I
It's
said
nice to have you, sir. Welcome.
thank you. I'm happy to be here. Like Dr. Daniel Omisande said, today is not going to be more of, it's going to be more of lectures and stories about, number one, we are talking about stroke, now, yes. Then we are going to hear about a practitioner also, who has been in practice for years. That's me. So if you hear my story, it will spur many people. So people will know that that's the way we do things. And like I say, and people say, I normally do my things properly. And tonight, I'm going to tell more of stories about practice also. So once again, you're welcome.
Good evening, all.
Yeah. Now, my name is once again Professor Cyril Omisande. I'm a former president of Nigerian Council of Nigerian Council of Natural Medicine. I'm the provost of Cyrillic College, like Dr. Daniel Raleigh said. So I'm the medical director of Cyrillic Holistic Hospital. I'm a member of Ogun State Alternate Medicine Board. Because of my, practice, I'm the only, non-politician in the board. Most of the board in government are always, jam-packed with politicians. Because of my work in Ogun State and Nigeria, the Ogun State government itself put me on the board that they want a particular. I've been doing my work for 31 years. And I thank God for what He has done in my life. And I thank God also for what God has used me to do in the life of many people. I don't know. Let me just tell you a brief story about how I got into alternative medicine. Basically, I studied transport management and automobile engineering in India. That was in the 70s and 80s. Then I came back to Nigeria to work. So I was working in a company called Temple Agoda. It's defunct now. So I was their transport officer. Then later they promoted me to transport manager. That was where I was working. Then my mother came from London. The third day she came from London, she had a stroke. So that's why I believe it's my calling. First, I went one way, and God wanted me to do another thing. So my mother had a stroke, and when I was in India, when I was studying in India, I used to read. I read a lot about so many subjects, so many topics, so many things. Anyway, I'm a man of, I know so many things. I'm not bluffing. It's medicine, I know. Engineering also. Some other things, I say I'm jack of all trades, master of all. Yes. They say jack of all trades, master of none. But I'm a jack of all trades, master of all. So anyway, I was working. Then my mother asked this too. Then, I was working. I was a manager. So because when I was in India, I used to see, you cannot see a stroke patient working, the way they work in Nigeria, this man has several stroke. Oh, this one has several stroke. You will know the way they work. But in my own case, in India, I used to see stroke patients, and there was one man also very close to where I was staying when I was there. So we used to see the way he was treating patients. And then my mother had a stroke, and I had a cousin. who was a medical doctor. He's dead now. So then he was involved in my mother's case. Then every day when I get back home to see my mother, the same thing, the same story. And this my cousin was getting a lot of money from us. At that time, 1,700 naira was big money. My salary was 800 naira. And my cousin was taking money from us, bring this from bring that. And my mother was not getting better. I just remember that, I had this man when I was in India. Let me quickly see what I can do. Then I called somebody. Please, what can you tell me to give my mother for treatment? My mother had a stroke. I said, no, I should come myself. I said, no, I can't come. If I'm working. I said, no, better you come yourself. And then that time it was very easy. How much was my ticket? 1,300 naira was the ticket. So I just took leave. I told my other, they gave me 2 weeks leave. I told them I was doing something. So they gave me that leave. I got my annual leave in lieu. So I went to India. Then when I got there, I quickly went, and my mother said, so, and all that. I said, no, we have to learn. You can learn something. Is it possible to learn something in 2 weeks? I said, no, you have to come and learn, go back to Nigeria. If you want to really study, you come back and just give me some basic things that I can use to help my mom to get better. Maybe later I will come back to India to study. Then they gave me about 3 or 4 magnets and one for water. They told me how to use it. That this is the way you're going to use your this thing. Then I came back from India. Not on the road. I gave my mother, they told me how to put magnets for the limbs, the affected area, and they gave me magnet for water, and they gave me magnet for oil. My God, within 2 weeks, my mother started working. And so you can do this. My mother started working, started talking. And then the family came, so this one, you can do this one. What work are you doing under somebody? Better you go back to India and start go and study. Brothers and sisters, that's how I went back to India. I resigned. When I resigned, my mother was telling me, I don't resign. No, you got this job. You want to resign? I said, Mama, let me resign. So then I went back to India. When I resigned, when I left, the company, my director came calling. He totally came to my mother. I learned your son has resigned because when I resigned, my boss was out of the country. So my mama said, I will see here. At least he was going to read more. My other said, why reading? Maybe if you want to read more, it will be a lot of money. I will increase the salary. So let him call him where he is. My mother told no. My mother called me. Again, for that salary. I said, no. That's why I went to India. Then, my mother supported me because I told her I was going to study what got you up from half dead a person. So that's why I went to India to study. Then, while there, I told you, I said I'm an engineer. I study automobile engineering from Madras College of Engineering. I did my postgraduate diploma in transport management, and I'm a member of the British Transport Administration. I think they are defunct now. So I'm a member of that. And I'm a member also of the Institute of Transport Administration of Southampton in England. And I went back to India to study. Then I started from diploma in magnet therapy, 3 years. Then my degree in magnetology. There they gave me 1 year, because I've got diploma, 2 years diploma. Then they gave me exemption, 2 years exemption for me to do degree. Then I did degree. That's magnet theology. That is, well, it's another name for magnet therapy. Anyway. Just keep it like that. Magnetology is magnet therapy, yes, in same time. Then after that, after my degree, my BSc in magnet theology, then I went to do my master degree, MD in alternative medicine. Then again, I went to to study also, to do my PhD in holistic medicine. So that's why I came back to Nigeria. I started with alternative medicine first. When I first started, it was Cyrillic alternative healthcare. Then that's it. You can see from the picture there, on your left, I was there with my mate, and that was when I was in India. Then you can see on the right side above, that was when I went to a shop to purchase what I needed. And that's my friend, Dr. Pradeep. Then that's me down, demonstrating, magnet, all the magnetic products we have there. You can see I was still a young man then. So then, like I was saying, I started the magnet therapy in Nigeria. When I started magnet therapy, people are wondering, magnet therapy, what is magnet therapy? People are just laughing. Even they said to my eye that when I say that brought me here, people are even talking behind me. He has gone to India to study magic too. That's what he went to study. That people go and study magic. Even medical practitioner in Nigeria, when Zabodi here then, he nearly killed me because people started coming to me because stroke. It became just like a household name in stroke treatment. There was nobody. Today, nobody. I was the pioneer, magnetotherapy in this country. I started it. No Nigerian started the magnetotherapy before me. That time, I was the doctor. I was the nurse. Only one girl with me. That one was the one giving receipt. I was the nurse. I was the one that would put magnets for people to apply magnets. Apply so many things. And as a magnet, you can see I have the patient there. That photo you see is over 20 years. And you can see me then. So I was applying magnet to a first stroke patient. That's a stroke patient. I was applying magnets. When me in my office then, at that time, I think I had an interview. So somebody was interviewing me. I think the press came. So I was demonstrating our product and the magnet we use there. So that's how I started my business. It has been a long time, and I'm still coming to talk about stroke. We have not finished. I don't want to tell story. The story I want to say is that when you are doing something, my people, do it well. None of our people, they want to do. You can see the way, how I told you, the way I started like, and I know many people also. Those who are doing or practicing alternative medicine today, most of them also it was not their first cause. But for me, I think God has made it to be like that. God used my own mom, my own mother, to to direct me, yes, in a direction, and I'm happy that So sometimes also, in some cases, God will use problem, your own problem, to solve your problem. Sometimes you see some people will be chased away from some houses. Landlord will just chase you away from your house, from his house, for a certain reason. One of them will just chase you away from his company. And in most cases, they push you how to make it in life. So that's our own story too. Now I started the Cyrillic, more. And you can see on the left side, that's my clinic, the Body clinic. That one side, that's our Ibadan clinic. Our own house, not rented house. Our own building. So we started from there. I started from outside, then God used me and I built the houses. I built this one first, and 3 or 4 years later, due to popular demand, people are asking, about the people used to come here, mainly from Shobu, from Ilesha, from so many places in the southwest. When they come, so we made that Ibadan for them so that they won't be coming to Jebu. So that time we started this, and both are still functioning. Cyrillic Jebu is there, Magnet House. Cyrillic also is there, Magnet House. I named both houses Magnet House because where I got the money through magnet therapy. And I thank God today that we have done what God wanted us to do. And as you can see, that's a nurse taking care of the patient. That patient had insomnia, not able to sleep. And as you can see, she's using electromagnet to treat. Then after that, after magnetic therapy, then I saw that magnet therapy was not enough. Then I started to go for my postgraduate diploma in homeopathy. Homeopathy. I don't know, maybe you know homeopathy. Homeopathy also. Today, I studied what we call clinical, classical homeopathic medicine. Classical homeopathic medicine is what I studied. I know some people are doing electronic homeopathic medicine. Anyway, I'm not condemning, but classical homeopathic medicine is what is known throughout the world. What is homeopathic medicine? You know, light cure lights. That's the basic principle of homeopathy, as laid down by the founder, Dr. Enema of Germany. That was more than 200 years ago. So there was problem between the alternative class and the Orthodox at that time in Germany. So Samuel Enema just cut away from the basic Orthodox medical practice to form homeopathic medicine. That is, light cures light. What's the name of that one? What thing you put in the body, or you give somebody a healthy person to take or to use, and that symptoms, and that generates symptoms from that person. But that symptom, you can use that thing that you use to treat symptoms in a healthy person. If somebody speak of that medicine you give is homeopathic medicine. So homeopathic medicine is light cures light. People here don't know much of what I'm talking about, homeopathic medicine. But, well, I thank God I've introduced that to Nigeria and people are embracing it. Before we came, people were practicing electronic homeopathic medicine, whereby some electronic gadgets were put there. You say, okay, this is this. They say that a code, you put one code there. Okay, this one is helping with this. This one is helping with this. This helping with this. But basically, it's not. I'm not condemning, because I know some professionals that are there that are listening to me. Some of them are practicing electronic homeopathic medicine. But the basic homeopathic medicine today is the classical homeopathic medicine, whereby we use dilution, potential dilution, then mother tincture, physically to prepare your own medicine. Basically, homeopath is a doctor and it's a pharmacist at the same time, because you have to, diagnose the patient, you have to give medicine from various available remedies. We have remedies that we call dilution, and we have some that are not tincture. So those ones you have to do. Yeah. So somebody who does not who is not bad cannot practice homeopathic medicine, because you have to pick from more than 3,000 or 4,000 remedies to make your remedy. And the homeopathic medicine, we normally say remedy. You don't say drugs, you don't say medicine. They are all remedies. So that's it. Homeopathic medicine for you. Magnet therapy. What is magnet therapy? I'm still coming to stroke, please. I'm just telling you stories. First introducing to you magnet therapy, then introducing to you homeopathic medicine. These are the basic things we use for our therapy. And by the grace of God, it's doing wonders. Now, magnet therapy, you have seen there on your screen. North Pole. We have North Pole magnet. We have South Pole magnet. We have electromagnet, and we have magnetized water and oil. Yes, North Pole magnet is stimulating in nature. Want to stimulate something, want to increase blood flow to part of the body, use that one. South Pole also for pains, where there are pains. Then sometimes also you have to add North Pole and South Pole together in part of the body. There are places in the body where you apply North and South Poles. They are called meridians. Meridians are where you put certain magnets, like acupuncture. You know, acupuncture also has a meridian, but the meridian acupuncture is so vast, many, more than 3,000 meridians you have to, learn. But magnet therapy, they are very few. So you put magnets in the body according to the disease, according to the problem of that person. And the use of magnets can correct diseases often categorized as incurable. Since the tiny cells of our body have magnetic frequencies, problem will come in. Disease will come in into the body when there's lack of equilibrium in the magnetic field. Now, our body, my body, your body, the tiny cells that is making up our body are magnetic in nature. We have the North Pole, we have the South Pole. Where you are sitting is magnetic. Anywhere you go in this world, even the heart itself is a big magnet. And the magnet has, every magnet has North and South Pole. So we and you that is sitting and that is watching me, you are holding your life to magnet. Because without magnet, nothing. It's magnet that will give equilibrium. When you are sick, it means you have lost the equilibrium, magnetic equilibrium, that is balancing. So that is every part of our body has frequencies, magnetic frequencies. That's why you see you get sick, because when we started, people are saying that magnet therapy is magical. It is not. Nothing like magic in magnet therapy. Because the way it works, even you think it's magic. Okay, somebody having stroke now. They brought him in. Somebody subconscious or unconscious, and within 2, 3, 4 days, that person started working. You'll be shocked. It's like magic, but it's not magic. It is, magnet therapy is science. It's also an art. It is science and also an art. So magnet therapy, like I said, it works faster than other known healing therapies. It is not expensive and it's not invasive. It eliminates disease states with natural healing qualities of magnetism. Simple. Now, homeopathic medicine. I said it before. In soap treatment, we have one medicine we call Tamaj. That's Stamina Arjuna. Stamina Arjuna, you put it in the mouth of the person every 2 hours. My sister, my brother, you'll be shocked by every 2 hours just put Stamina Arjuna. We call it Tamaj, but it's Stamina Arjuna. It's from a tree, back of a tree in India. It's an Indian tree. Then we have belladonna also. These are the potentized dilution. And we have Posatilla. All these things you are mentioning are what we use for stroke. It's like Tamaj. Stamina Arjuna, by the time you use, every 2 hours just give the patient, a person with a fresh stroke, you'll be shocked by this recovery. Me, there was a day I was shocked. somebody came in. I mean, they brought him on wheelchair. He was vomiting his rice, vomiting what he ate last night, and he came down here. And then we took him in, and we have a therapy room. Then we quickly apply magnets to parts of the body. Then we apply magnets to the head to remove the clot. But I mean, I must confess to you, me too, I was told. I've never seen such miracle. Just miracle, not magic. I was sitting in the reception. I mean, just looking with some patients. This person walked out. This somebody was on wheelchair. They brought him out. He walked on his own. That's one wonder I've seen. Since I started this my drop of healing. So that is it. Then ABBA also. We have some medicine also like Saffron. Saffron is in Nigerian medicine, is very good. Then Aswageda also is very good. Ashoka is very good, for patients. I mean, Ajin, very good medicine to bring down blood pressure. Allopathic also, we use it to bring down blood pressure. And some patients where they are diabetic, you use all these medicines for them to help them with that recovery. Then nutrition. We normally give people anti-inflammatory, diet. Because when you are sick, when you have stroke, the stroke patient has to be calm and calm and calculating. That is, no, that person has to have a lot of rest. Then stimulants. You don't give stimulants like coffee, tea, and then they don't go for meat, no meat, no all this junk food. These are things only diet. You can give fruit, you can give carrots, you can give apple to a patient, but not all these stimulants. So now you can see that's magnets. These are magnets we use for our therapy. That round one, that wooden one that looks like round wood is electromagnet. You plug it in and you apply the magnet. These are the magnets. We have the small one, and we have the next one. We have the other one. These are categories of magnets that we use for our therapy. And it depends on the treatment. It depends on the patient you are going to treat. That is, the magnet you are going to apply on the patient depends on the problem of the patient. So that's why you have the big one, very, very big. You have the biggest one, 3,000 gauss. Magnetic, magnet is mentioned in God. That is, God is power of magnet. Then the next one, after the biggest one down, is about 2,000 gauss. Then the next one up, that's one, we call that one low power magnet. We call it medium size. That one will give you 1,500 gauss. Then the one up before the smaller one is about 800 gauss or 1,000 gauss. Then the smallest one, that's 400 gauss. And those ones are cheap. You have the one North Pole, you have the one South Pole. So we have 10 electromagnets. When you plug it, electromagnets cannot work alone. Magnets have to be with it for it to work. We use it to accelerate the work of magnets in the body. That's the electromagnet. Then these are medicine we use for our patients. I was telling you about Saffron. Saffron, we give it to that stem cell is very good for stroke patients. So we are distributors in the country. And then you can go on the left side, that's Indian medicine. Then we use allopathic, we give it for blood pressure. Again, I've mentioned all these medicines to cool down the brain. And Aswageda also, Aswageda is very good for recovery from stroke patients. They are still coming to stroke. I'm just trying to introduce all this to you. These are homeopathic medicine. Yes, I was talking about telling you about homeopathic medicine. These are some parts of our. I said we have over 4,000 remedies, dilution. The one on top are dilution. They are made from from products of the body. Some are, as you see, some are products. Some when we say dilution, dilution is in science when you dilute something from saturation and all that, and they become potentized. See, the potentized, what you see, small like that, they are the names of medicine we use. So each one has a name, and each one sometimes you combine, and sometimes you use alone. So when you combine dilution, it can become compound homeopathy medicine. So then sometimes you use only one. That's only homeopathic medicine. So it's either compound or lone homeopathic medicine. Then the one down in bigger bottles are mother tincture. Mother tincture are made from tea, bark, leaves. Most of these things are imported from India. Those ones, small ones you see that are in plastic, these are the medicine we made for our patients from the dilution up or from the mother tincture down. These are what we combine to make remedies. So very, very interesting homeopathic medicine. Then stroke, challenges in stroke recovery. Now, before I go into that, let me now start stroke. Let me talk about stroke. What do you call stroke? We have two types of stroke. We have the ischemic stroke, that is the one that because of blood clot in the brain. That is a very, very interesting topic now. So, because people don't actually know stroke. Some people say, yeah, he has a mild stroke. Some people say he has this stroke. Well, mild stroke, when they say mild stroke, I don't know. Once you have clot in the brain, that is a injection of blood to, to the due to blockage of blood vessels in the brain into the brain. That's the ischemic stroke. That is the blood, just like when you, how do I describe it? Okay, when you push a pipe in water to flow to water your this somebody just block it. Then when you block that, water will not go up again, just like that, because it is blocked. And the blood will not go, and through blood, oxygen will not go. Through blood, all this food we eat, nutrients, will not go to the brain, and it will kill the brain because the brain is made up of so many neurons. So, but in part of our body, we have these small blood vessels that are called capillaries. They are so small. They are too small so that there shouldn't be anything to block it.
Bobby.
There shouldn't be anything to block it so that because once it is blocked, that person will lose part of the body. I mean, the usage of the part of the body. I mean, a part of the body, limbs and all that. Then we have the hemorrhagic stroke. This one, when the blood this one bursts, and it will flow into the brain. The blood vessel bringing this thing. That's due to pressure. That is anyway. Let me quickly go back. The ischemic stroke is very common. That's that's common in Nigeria. Not only in Nigeria. That is the commonest stroke, and it affects about 70%. And let me tell you something. about because it has something to do with race. You hardly see an Oyibo man having stroke. The stroke they have is due to this morally. But you know, hello, are you listening to me? Hello,
Hello, sir.
Yes, we can hear
are,
you.
We can hear you, sir.
are you all, because I can hear some.
Yes,
Are you
yes,
hearing
sir. Okay.
Please,
loud and
everybody
clear?
should mute themselves. Please check yourself and mute your somebody's is on mute and is disturbing him.
Yes, okay.
Because we are some we are having some disturbance here. We are not able to. Please, can you hear what I'm saying?
Yes, sir.
Yes,
Yes,
we
sir.
can hear you,
And are you
sir.
We
enjoying
can
what
Yes,
I'm
hear
we
you.
can
saying?
hear you, sir.
Yes, sir.
Okay, yes. So, like I was saying, we have this systemic stroke that affects, that causes a blood clot in the brain, that is reduction of blood into the brain, and it depends on I mean, of the size of the clot. So you see some people they just lose sensation of movement. Some it affects their eyes. Some even it affects their hearing, and some also they become unconscious. And that normally happens to people with hemorrhagic stroke because they have this bleeding to the brain. By and large, we are able to prove in this country that it's possible to treat.
Please, can you mute yourself, please?
Somebody please
Omoyemi.
mute yourself.
Omoyeni, please mute yourself.
Please, this person
Omoyeni,
should
please.
mute himself. Please, mute yourself.
Omoyeni, please mute yourself.
It's very, very interesting. Please
They should remove Omayeni now. There's no need of telling.
let us just do things. We are adults, and so that we can enjoy what we are doing. Anyway,
I
let me
don't
continue.
understand.
Mhm. Now, uh, can I continue?
Yes, sir.
Uh-huh.
Yes,
Yeah.
sir.
But
Are you enjoying
Omoyeni,
it?
please mute yourself.
Sir,
Please,
please, that
Omoyeni,
person is
because
even
Yes, sir.
making
We
that
we are,
can
we
noise.
are
hear
Can
having
you
you.
Please, they
please
should
problems. We are
remove
remove
hearing
her
sounds here,
now. She's
and
disturbing.
it's disturbing us. Please,
She's
mm.
disturbing. She's disturbing, please.
It's disturbing. Please. So, now, like I was saying, stroke affects in Nigeria here. Stroke affects more than 100,000 people every day in Nigeria. An alarming 45% people lose their life because of lack of adequate treatment. Stroke is the third leading cause of death in Nigeria. Disturbing, as you can see, a significant part of the remaining are disabled for life. 80% of stroke cases are preventable. Yes. I normally tell people when people come here for treatment, I normally tell them it's due to carelessness. So they will look at my face. Yes, carelessness. When you have stroke, one thing, when I tell people, some people will be looking at me, stroke will give you, before you have this attack, you will have some symptoms. Yes, so many symptoms. But some people, they don't, in Nigeria, we don't go to hospital, you don't take care of yourself. Once you have something, maybe you use something like alabuku or iole or something, then you just believe that you are okay. Instead of to go to hospital to get your body checked, you don't do that. Then all of a sudden they have this food. They say, no, it's, that person just fall down. No, it's not like that. Before you have stroke, you'll be having sensation in the hand. I mean, you have this sensation in your hand. You have one-sided headache. It may be dull headache. You have it. Then sometimes you have vertigo. That is, your hands are turning. You'll be turning. It happens. Ask any stroke patient. How do you feel? Well, I've been having vertigo for some days. I've been having this for 1 month. Know how it will give you sign, and that sign is not people don't actually follow. So more than 80% of the stroke are preventable. Yes. And if you notice, stroke normally occurs in the night and early in the morning. Why is it that? Because the body, the thing that is cool, everything is cool. No going out, no movement. Sometimes some people, when they go out to maybe to urinate the toilet, when they go to the toilet at midnight, they just fall down and they say, oh, some people are pushing. I just feel some hand in my body, and the unseen hand push me. It's not like that. Nothing like that. It is stroke. And this stroke is not magical at all. And it's not, I don't believe in all these superstitious belief that, because if it is true, somebody is attacking them with stroke, why are they getting better when they come to us? But I can tell you, I have 98% recovery rate of stroke patients. Yes. Anybody can come to Cyrillic and to be able to ask about Cyrillic. Yes, that's it. Even from general hospital, from around, go to Cyrillic if you have this thing. We don't have it. From hospital, go to Cyrillic. We don't know how they are doing it, though, but I know if you go there, you get better. And it's even our house. Our ward is not able to even contain our patients. So, what are the risk factors? The risk factors of that is causative factors of stroke. Hypertension, number one. When you are hypertensive, please use your medicine. Use your medicine. Use your medicine. Then diabetes, smoking, excessive alcoholic consumption, heart disease, high cholesterol level, obesity, sedentary lifestyle, excessive use of contraceptives, HIV/AIDS, family and drug abuse. These are factors. These are factors of stroke. Like I said, if you are hypertensive, use your medicine. If you are diabetic, the medicine they give you to use. These Nigerians are so careless when some people do that. When you take your medicine for some time, you leave it. You are okay. Once you are diabetic, my sister, my brother, once you are diabetic, please continue to use your medicine. Sometimes, you will be using high dosage earlier but later you can reduce it. But not that you leave it entirely. That I know I felt good, so I don't have problem again. And get my sister, my brother, it will come again. That's not cause. I'm not causing anybody. When we talk like that, that's not the cause. Because if you are not careful, you suffer stroke again. You have seen people suffering stroke one time, second time, very. If that person is able to get better, then third time is the worst. You have seen patients when they are careless, and they have 2 or 3 or 4 times. Then smoking. Smoking is another problem people have that causes stroke. Then people that drink too much, excessive alcohol consumption, then heart disease, then high cholesterol. So these are things that can cause stroke. Anyway, you can take steps to reduce the risk. What are the steps? If by chance anybody suffers stroke, the chances of successful treatment and subsequent rehabilitation increase manifold if that person can come on time. If you can begin treatment on time within days after the attack. After the attack. That's why they call it brain attack. What is brain attack? Everything changes within minutes. Time loss is brain loss. So, in the treatment of stroke, time is very, 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 very important. Then, challenges in the recovery of stroke. Patient adherence to rules. Don't do this, don't eat this, don't do this, don't do like this. People don't normally adhere to instructions. Then, this superstitious belief. I've said it before. Somebody is doing it, somebody is doing this. Then people believe so much in, and when you suffer stroke, it's one person there, especially maybe you have problem with somebody around that period, that person suffers stroke. They say, it's somebody that is doing him, somebody that caused that person. Me, I don't believe in it because if it is true, if it is true, why are they getting better when they come to us? And we are not Babalawo, and we are not Onisegun. We are not, we don't have anything more than this, our magnet and our party medicine to treat patients. And people, when they come here, they get better. So when we first started, people were thinking that maybe we are using something, this magnet is from, maybe some magic something from India. It's not true. So, magnet is a magnet, and it has not pole and south pole. Although the material used to make this magnet may be different from the one that is we use for fans or loudspeakers. The magnet we use for treatment of stroke or our own treatment generally is made of ferrite. Ferrite is a material that we use to mold and make magnets. Because ferrite will, the magnetic power will go straight to the body. And once you enter the body, it will stay there permanently. But the magnet used for, a fan and all these things, stickers, that one you cannot use for treatment. If you use for treatment, when you apply to the body, it will take back from the body. So it's just useless, as if you didn't treat that patient. That's just it. That's the type of magic. So I'm just trying to tell you that people will think that it's magical. It's not magical. Then, patient relatives. Patient relatives play a great role in, no. Let me, I should not believe. I was talking about that one. Sorry. People believe, like I said, that maybe somebody is doing them and all that. They continue to go to where they shouldn't go. In this present in Nigeria, some people still go to church for stroke treatment. How can you go to church for stroke treatment? Now, I believe in prayer. I'm a Christian. Yes, I believe in prayer. But is it a prayer or what that will remove the blood clot, that will decrease the sugar in your body, and all that? People shouldn't be deceiving themselves. Even the pastor that you go to meet, that is praying, is common in all these white garment churches. He also has his own problem. I have a lot of them as my patient. Somebody will just ask you to sit down somewhere, doing it daily, because this stroke is you need to stay somewhere. I'm not condemning anybody, but church is not where you go for stroke treatment. Patient relatives. Yeah, patient relatives also play a lot of roles. And that is what I'm saying, that as part of it. Sometimes we are placed here. Patients will be with us here, will be in our care, and they will still bring people from outside. They will disguise as if they are innocent. They will come here to use certain things on their body. Some pastor will come to hospital. When you know that that pastor that can pray for you, why don't you go to pastor instead of coming to hospital? So these are challenges in treatment of stroke, in stroke recovery. Then caregiver burnout, by the time caregiver will, because it's a lot of work to take care of, especially at the early stage, before the patient, start to walk or start to move. The caregiver also will do a lot of work. Sometimes it takes on them. I've seen in so many cases, whereby patients will come, like especially men and women. They will come, those that are their caregiver, they will be relations, sometimes they are relations, they will be wife, they might be husband. When they come to treat that patient, by the time the patient, is discharged, you just hear that that person that that came with that person is dead. You know why? Because of the job. These are challenges. So anybody who is going to take care of a stroke patient as a caregiver must be a strong person. Then another problem challenges is financial constraints. Sometimes people want to do, like people say, ọbẹ̀ tó dùn, owó ló pa. I don't know people that are here, they can hear Yoruba. Also, ọbẹ̀ tó dùn, owó ló pa. That is sweet soup. Soup will be sweet, tasty, and there are good ingredients. Yes. So it's not easy to take care of stroke patients. Not even not care patients. Many ailments. You have to spend money. But sometimes in the recovery, people don't have money. Some people, when they bring them here, they go back because they don't have money. Then ignorance of our practice. I've said that before. That is ignorance of practice. Some people, even to today, despite the fact that they have spent 31 years in the body, people still believe that magnet therapy or other alternative forms of medicine is magical. It's ignorant. They don't know. Nothing special in magnet therapy. It's magnet that we use are scientific in nature. Nothing, no abracadabra here. Nothing. No abracadabra. No, not anybody putting. So people will come here. They say you are using magnet. I guess. Can I see? Oh, go and bring magnet. You have that challenge. Well, go and bring magnet. Some people. Let me see. Which day somebody came, said I'm going to sponsor this patient. Sir, I learned that you are using magnet to treat patients. Then I said yes. Can I see? Look at it. We have magnets that are made of plastic. Some are stainless. You look. It's full quick magnet, nothing shaking. Well, I just want to see, sir. So don't be asking, no, I'm used to that. But you, as I see you are educated. And before you ask for, why don't you go and Google magnet therapy? It's there. Everything is there today in Google. Nobody can disease anybody about anything in this world. Nobody can disease anybody. So ignorance of practice of what we do is still there. So people still think that it's magical. Nothing like that. Then you have this rivalry. Industrial rivalry. Industrial rivalry is the other side of the practice. This orthodox medical practitioner. When I first came to Djibouti, he's dead now. I had a reverend father. He came here. He quickly came. Today, you have to get a gun license. So, people are talking about you. They're talking about you that you are taking there. Yeah, I was in the midst of some medical practitioner. They are talking about you. You need to get a license for you gun license. I was shocked. Yeah, no. I was there with them. I was told that it's not. That was when I first came. I'm talking about nearly 25 years ago. Till today, my brothers and sisters, orthodox medical practitioner don't look at us with good eyes. Even despite the fact that I've been in the body here, they still talk. I don't want Jenny. See, if I'm telling you for the past 31 years, now if I'm listening to people, let me go to talk in the language you understand. See, you can't deceive people for 31 years. You can't deceive people even for 2 years. But every day you are growing. From hospital now, we went to training at college. Only God knows, or again, where we are going. So if we are deceiving anybody, it will be shown, people will know easily, nothing like that. But one thing I will tell, don't argue with anybody. Your work will talk for you. Today, I have some doctors, medical practitioners, at least the orthodox medical practitioner. We are all doctors. Sometimes they say, no, it's not a doctor. Anybody that, a doctor is anybody that treats people. That if you are qualified to treat in higher ground, not everybody can be doctors anyway. Because I know some people will go and do 1 year, 6 months and still they are doctors. They don't call yourself doctors. Go and study more, get higher degree, higher qualification to be called doctor. Because by the time all these people that are talking about us, it's because they have seen some lapses in some places. But today, no doctor in Ijebu here or here, anywhere in Nigeria, can challenge me in this my work I'm doing. Because they have tested us, they have pushed people to us, to trust us. I've never had, since I started my job, I've never had any police case. Because I did my things here. My life, I don't do abakada, I don't cut chances. I have many policemen. There's no police in this Djibouti, DPO or area commander. The first place they want to come is Cyrillic hospital. Because they all have SLNG. Most of them have SLNG. They come here. So we see them. Hardly any DPO will come to Djibouti or area commander that will not be my friend. They will come. Only God knows the way they know. They will come. They look for me. They will look for they will just sit down and see doctor and so and so and so. If by the time you see them in the orderly, you know that these are even today I was in the barracks to see the CEO. So there are so many things. So if you do your job well, people will come from you. Even doctors. I've treated doctors' mom, their children, they themselves. Now we have one magnet that we use to treat patients that will to remove clot from the brain. It's just like magic. Once you have this clot in the brain, like I told you, you send it the stroke, reduce the clot of a blood artery. We have this electromagnet. By the time you just use this, like that's electromagnet for you. Yeah. You just put it with magnet, my sister, my brother, clot will be solved. We know that in orthodox medicine, they normally open up the brain, and that person can never recover. We have seen them. Sometimes when they become mad. It's not easy to open up the brain, because they are capillaries. Small blood vessels are called capillaries. These capillaries, somebody opening capillary of tiny blood vessels. How will it take it back? How will it squeeze it back? So there will be excretion. Some of them they behave like mad people. Some of them will develop edges. Some of them will even have tumor in the brain. So this is very simple thing. Then you put it on the head and the magnet, it will really clot within 2, 3, 4 days. So that's how we have this process to occur. So now you can see that's a stroke patient. That's our nurse treating the stroke patient. What we put on our head to remove blood clots is due to patients when they are still very, very fresh stroke patients. You see the magnet on our hand, and if you put in our hand, we have the North Pole and South Pole. North Pole, that one will help in the, like I said before, I told you. So our body is made of it's magnetic nature, and all the tiny things in our body, cells in our body, in our blood, in our body generally, tiny cells are magnetic in nature. By applying the palm on magnets, North Pole and South Pole, you are trying to wire up frequency in the body. You are trying to balance the magnetic frequency in the body. You are trying to create equilibrium. So the equilibrium, that is balancing of the magnetic body. Then just see that the patient is, and then that the one you put on the edge just for a few minutes. Just see the patient, you recover, and you'll be shocked. This mama is working. In the course of it, I will show you a patient also that recovers. No, you'll be shocked the way she recovered. Yes, this one. That's the woman that is sitting on the right side. That's the woman on this here. That was when she was brought down here. She was a tip. You can see. That's what you can see. He had a problem on the left side. I mean, no, right side. And he was brought down here. And he started working less than 2 months after sitting with me. That person. So it's very, very easy. That person, can you believe that somebody on that wheelchair and now is sitting down like that? You can see when she was brought in, and you can see her now. Probably just blocked the face because I don't know anybody that will know her. So that is one case one. When she came, she was diabetic and hypertensive. And we thank God that's the man there. Less than 2 months. Yeah, on the wheelchair there. Yes, this is another patient. Long-term stroke recovery success. You can see she's a teacher, she's a retired teacher. She has stroke. See the way she was smiling, she's happy. She was getting out of our clinic. She's going back home after treatment. So you can see she came down here and she's having stroke. I mean, stroke for she's obese. You know, obese people don't normally get, their recovery is very slow because of the, the weight and the, fat on the body. The blood vessels are impeded and tight. Because, stroke has to do with blood. Blood has to move in the body. But for fat people, it's very slow in the body. So you can see, but it's okay. It's working. Nobody can say it's having stroke. It's our teacher. It's our administrator. Yes. Now, other pharmacy. That's homeopathic pharmacy. Yeah, like I said, we use homeopathic medicine also. Our treatment is 60% magnetic and about 40%, 30% homeopathy, and the rest 10% is about medicine. And the remaining 5% is nutrition. And then you tell them how to do it, and they get better. So that's homeopathy. That's our homeopathy. That is the same woman. That's our homeopathy. Pharmacy for you. Now, tell them public work. Well, we thank God for what God has helped us to do. In India, I was called for when I got my professorship. I'm visiting professor of a university in India. So that's me there giving a degree to one of our students in India. So there, at the other side, so I've done a lot of public work. People normally invite me to, to places, to teach, and to go for workshops. And even now, as present in organized by the Ogun State government, organized by the Ogun State government, we're having one workshop. So then, here I am. I'm in a palace, as you see me, one Oba Kabisi invited me, and he brought down so many people because this stroke thing has been endemic, and it can become an epidemic. Today, 3 stroke patients were the one that came. In fact, we couldn't accommodate 2 because we don't have accommodation for them. So stroke has become an epidemic in Nigeria, and the reason is due to carelessness. And apart from carelessness, maybe poverty. Because even when they say they should be treated, many of them don't have money to treat. So that's why I'm there, contributing what I can do. That I was talking then to patients. So the KBC got a canopy and invited so many people to his palace. Then here I am talking to people before we start the treatment. So then the other side that I was in India, I went for academic work. So I'm a visiting professor. Yes. I know some people will be laughing. It's less than a quarter of what I have. Some of them I cannot display. Less than a quarter of my certificate and things I got and everything. I have a lot of them, that I have not hung. That I'm here to put on the, because no place to put. So, we thank God. They have been recognized by the government. I was, when they started FECAP, there's a college in Abuja, federal government, they call it Federal College of Alternative Medicine, FECAP. That was 2010. I was one of the first practitioners that made the consultant. I was a consultant for 2 years. I left on my own because it was affecting my practice. I built up a practice. So we're going to, what else do I want from the federal government? That time, they tell us to come down to Abuja, they pay the transport here, they give us hotels. I have to spend about the first working day, the first 5 working days in Abuja with the federal government. So then I have to come back to my practice. I was listening patients. My patient was, Doctor, you're not an under. Why that? Why that? That you want to go to Abuja or in Abuja? The government just use you and dump you. And, then after 2 years, I just stopped. They came, they begged me, I can't do it again. So, these are part of my, awards and degrees and all that. So, well, behind the white coat, all work, no play, make that a dull boss. I have time for myself. So on the left side, in London, I went for that's my sister opposite me. That's the husband in the middle. So we went there for birthday. So I didn't want to be a dull boss. So I have a personal life. I enjoy myself. Okay? The other one, that's a festival in my town. We call it Eddie. It's Festival of the Colors. So people gather in my town. It has been more than 2,000 years of this thing. We have Festival of Colors in India. We also have in our town. You can see myself, my clothes, soap in different colors. Doing that, people will be walking about. That's my sister also from London. The whole of that, she came down from London. So that's my sister there. That's my same sister there. That's my wife beside me. So it's every year we do it. I'm very, very, very. So one has to have time for yourself. Yes. Now, Brendan, we are there in Ekiti State, where they called me to be a speaker in the launching of a book and the foundation. Yes, I want to tell you something about this practice we are doing. I want to reflect. See, practitioners, it's good to be good in anything you do. Some people want to be in practice to make money. See, if you do well, if you do things properly, the money will come in. I've never seen a poor doctor that is doing well. Yes, if you do it well, you get what you want in this world. But I've seen something in this country. Most people that want to be practitioners, they want quick money. They want to make money. Some of them, they want to do diploma 1 year. They want to do 2 months to start to make money. My brother, my sister, that's not it. If anything you do, I told you, 31 years is not good. If you do things properly, you'll be recognized. The money also will come in. Yes. The money will come in. You will enjoy yourself. But don't do things in a standard manner. Do the things you know to do. Now, I have a lot of people that are doing a lot of things, but I try to limit myself to only two. But I'm not practicing. I know other therapies, other things, but I'm practicing it. Sometimes, when you want to practice everything, you just see that you are going nowhere. Brethren, I'm sure most of the people that are listening to me are practitioners. Even apart from practitioners, one thing you do, my brother, my sister, you have to do it well and properly. Anything you want to do, get trained, get properly trained for it. Not because somebody is doing it, have made money, let me go into it. You don't even know maybe you're caught for that. Although that's a saying in Yoruba, I don't maybe you don't understand that. I'll come back to interpret. Ori lo mo iṣẹ́ àṣelà. Ori lo mo iṣẹ́ àṣelà. That is, God knows the type of work you do to make it. My friend is doing this, I want to do it. You may not be caught for that one. Anything you do, and you do, God will do with you to make it. But if I doing things, because just to make money, see, I told you, 31 years is not a joke. I started as a practitioner, I was alone for some years, 5 years. Then, when I started, from 1 room or 2 rooms, then to a flat, from 1 flat to a building to a house, and all that. But it's not. Rome is not built in a day. Now, if you want to be a practitioner, my sister, my brother, do it properly. Get trained for what you are doing. Some people are learned sometimes. Some people, this man is doing well, making me too. And they just put margin together. And they are doing it. So, they have problems. The margin you think you see that is simple thing can kill you within minutes. Because there's a place you cannot put magnet. There's a place in the book if you don't put magnet. If you put magnet, you will kill people. Then, why do you want to do that? Why do you want to kill human beings? And also from other practices. I've seen some people, they didn't learn this agbo, this about thing. They just started selling agbo. I've seen a patient in Ibadan that gave agbo, and a patient, a man, yes, a very, very, it's a banker, just bought agbo. He went to mechanic workshop, and they were selling this agbo. Oh, please, Alagbo, bring it. And he drank Agbo. And that was the beginning of his end. Because as soon as somebody who did not have, you didn't have any problem with your kidney, there and then, you develop kidney problem. Yes, within days, within months, you have got CKD, complete, chronic kidney problem. He died in India. But the way, because he eat that agbo, some leaves or some bark, there are ways to prepare them. I have one thing we call photosynthesis. For you to triture it, you have to pour hot water on it. Hot water. If you don't do that, it's toxic. You are going to kill people. Some people don't understand that. So many other things that are there that people have to do to prepare certain things so as not to kill human beings. That's why it's better to learn something that you are doing. I've learned some people are doing homeopathic medicine, and then they want to practice homeopathic medicine. They want to do within 1 week. No, you can't do it 1 week. Study well. Study it. Yeah, there are diplomas, there are certificate courses in 6 months, there are certificate courses of 10 months, 1 year. Yes, that's what we teach you. But is it possible for within 2-3 days or 4 days? It's not possible. After you have learned, you still have to go through some tutelage under some practitioners to become master. Some people they want to start today and become practitioner tomorrow. See, you are putting yourself in trouble. Even the money you make from it, you enjoy it. The money you are going to make from it, you'll be. That's the way God will do it. So you enjoy yourself. You won't make the money. Even if you make the money, I'm not forcing people. I'm just talking. So please, anything you want to do, go to learn it. Go to college. Go to school to learn. After learning, go for practices. Practical. It's not possible. When I finished in India, I worked with Indian hospitals. I was there for nearly 6 months. They gave me certificate. Because you have to. Medicine is not mechanic workshop. It's not tailoring. It is not. After you have graduated, many people graduated that day in our college. I encourage them to do for practical. Don't just say, yes, I want to become a guy all of a sudden. No. You need to go and work under somebody. You can't be a master in a day. Yes, it's not possible. You have to go through the reading of getting pride. They will teach you, you do this. That is the essence of QS. I'm sure most of our students now that study with us, they went to QS where they get experience. In some places, some people don't go for experience. They just say, okay, I want to get this and this and people will know. People will know that you are safe. The way you carry yourself, the way you do things, they will know. We are not advertising. People still come here and here and here. Some people, after 15 years, they will still come. Doctor, are you still there? Yes, I'm here. That's how it should be. I was here 20 years ago. I was here. My brother brought me about 30 years ago. And some people came here some years ago. They are going to introduce me to these people. That's how it should be. Today, I received gifts every day. Before we started this thing, when I came from outside, when I rushed in to start this program, I met those of baby bread on my table. I asked my secretary, it's my patient that brought it. Every day we receive it. The patient that brought this cow for me when I was preparing for New Year, because they're happy. The person that is happy, they will give you things, they will even pray for you. They are praying for me, and I'm happy the prayers are being answered by God because I'm doing my things properly. So brethren, practitioners, non-practitioners, anything you do it well. Do it in the proper way, and don't cheat people. Cheating is part of life for some people. That will let me because they want to make money. The money you go through another channel, the money you think you are going to make, that's God in everything you do. The money you think you are going to make illegally or in another way, you go through other channels. You may even use it to train your children, and they may not give you peace of mind. Anything. You may even start to get sick, and then you spend all the money there. God is there. Some people will be thinking that God is not looking at them. Anything you do, God is there. So please, do your things fine. Do it well, and get trained for anything you are doing. So we have, I'm happy I'll be able to do justice to the program. Actually, our program is self recovery, and again, to know about life generally. Then, very soon, the floor will be opened for people to ask questions. So, thank you for listening. I'm happy also for to be here to talk. Thank you for listening.
Thank you very much, sir. Thank you very much, sir.
Thank you very much.
We have a few questions coming in, but I want to read a question from Mr. Kwemi Kundayo that he had typed way back. His question is, have you written any books on homeopathic medicine and or magnet therapy? That is question, sir. The first question.
Yes. Thank you very much. Yes, I've written journals, I've written in magazines, and even now I have 2 books that are in print. Homeopathic medicine, even 3 books that are in print on homeopathic medicine, on magnet therapy, and lifestyle changes. So very soon, Mr. Koyemi, in the next 2-3 months, you'll get books from me on the subject you are talking about.
Okay. I believe before we read the question from Abidemi, we will have a few people who had raised their hands. Okay, Mr. Okoyemi asks another question, sir.
Okay.
Is it possible to order for the remedies as recommendation for some of our clients without coming to your clinic?
Of course, yes. This question also has been asked by the state government because we want to start to manufacture medicine. And yet, now the medicine we are having, remedies we are having, we are there for us, for our own use. But I'm making moves now to import medicine in large quantity. But I belong to a group of, who is who in homeopathic medicine in Nigeria. They also asked me that they want to buy remedies. It's not easy to buy remedies from abroad to Nigeria, especially when you are not a practitioner. In India, they never said to you. So very soon, but presently, I'm sorry, what I have now is not enough for me. But by God's grace, very soon, we're going to be importing medicine so that we are going to have homeopathic, pharmacy where people can come in and buy their remedies.
Thank you. So for those who have been raising their hands, we will take the questions from them. We have Ezechinenye who has a question. Please, madam, please proceed with your question, ma'am.
Thank you very much, sir. First of all, I want to thank
Madam,
Prof.
before you ask question, did you enjoy this? Is it a lecture or this thing? Did you enjoy it?
Yes, of course.
It's clear and clear.
Yes, sir.
Okay, I'm happy. Okay, ask your question.
Okay, Prof. In fact, I'm excited. I want to thank you, and I feel good that I'm a part of your school. I'm a student in the school, and I'm also excited that I'm in the right direction with regards to my profession. So my question now is, when you were talking to us, you talked about magnet therapy with regards to removing a clot in the brain. And then you said that it's very important to bring the patient immediately after the stroke so that the clot can be removed. Then my question is, what of a patient that has taken time, that's a stroke patient that has taken time, and by the time they discovered you, maybe it has taken time. Can also magnet therapy cure the stroke patient and also remove a clot from the brain?
Thank you very much. That question. I get that question. People normally ask us that question. Yes. See, an old patient, like you mentioned, we can't remove clots again. You can't, but we can use magnet because see, removing clot is let me say, because really that person has stroke, the first thing you do is to people will be pulling hands. That's not the solution. They're pulling the hand. That's not the solution. The solution is to remove clot first, and clot is easy to remove when that person is very, very fresh. But if stroke is still 1 month, 2 months, yes, you can remove stroke. But any stroke that is more than 1 year or even 6 months, you can't remove this thing because it's already there. But what we do by applying magnet, by applying magnet in the body, it will, like I said to you, that magnet, our body is made of tiny magnets. By putting magnet into the body, by that patient using magnet, by putting hand on the magnet, like the way we demonstrated, we have seen that many patients recover their speech, recover the limb movement, and any other thing. We have seen that. But that's why we normally say, I tell people that when you have two patients, apart from the patient, new patients, don't reject old patients. Take them. But they are just, you help them by putting magnets on the body, you help them for their hand. Some people, we have this tiny hand. And some people, we have this hand that is already stiff. By applying magnet and oil, magnetized oil, you open up you make it flexible. You make the hand flexible. And the limbs also, you make it flexible. So, not that you reject, but it's very, magnet, that thing is very smooth. When the scope is still very, very fresh. But not that, those ones, those that are not fresh cannot recover. They recover also. But it's not as, because somebody, okay, like example now, I have a patient now. I think they said they had this stroke in Kwara State, 2-3 years ago. So that person was brought to us. He's an old man. And another thing that affects recovery of stroke is age. Younger people recover fast than old patients. Now let me go back to what I'm talking. Now that Baba has lost voice, he has lost the movement, his hand is stiff, leg is stiff. When they come to me, I tell them, this voice you are talking about, please, I'm not promising you that you talk, but I promise you that we make flexible the limbs, that is the hand and the leg. You understand? So have I answered your question?
Yes, sir. Thank you very much, sir.
Great. Thank you very much, sir. That was really good. Thank you. So we will go to a question that came earlier in the chat. It's a question from Abidemi Oluwadamilare. And the question is it only stroke that magnet therapy can heal? That is the question from Abidemi.
See, we are talking because I'm talking about stroke and magnet vis-a-vis stroke. That's why it looks like I think you're talking about magnet and stroke. No, magnet can be used for more than 200 cases. Arthritis. Arthritis is another thing you do easily. Last, lumbar spondylosis. Lumbar spondylosis, you know what lumbar spondylosis is? That back pain, the degeneration on the back. That's spondylosis means degeneration of the bone of the back. Then the spondylosis cervical spondylosis is the one on the back. Back of the neck. That's neck. Magnet can grow back cartilage. We have used magnets we have a lot of patients in this house that we use magnets who have never thought they will ever work in their life. We use magnets to help them to grow back their cartilage. And the people with arthritis, you see some women with they cannot work. They believe they cannot work in their life. They work. So magnets, we use magnets to treat so many diseases, not only stroke, because stroke, we are talking about magnets today. These are this stroke because it's stroke we are talking about. That's why magnet, is being limited to this stroke thing. We use magnets to take care of so many problems. Fracture, we take pressure. And people with accidents, by the time we align their bone, we set it, then we put magnets. Quickly, it will join together, the joint. I've treated people, somebody from Unilag, from Lagos State Hospital. I don't know. That person has fell down from Okada, and that's the broken neck. The doctors here, they are perplexed. That person, when she got that many people are dying in that place, one night, she ran away from that place, and somebody met her. What happened to you? Your neck. You have to hold this neck like that. And it was brought to us. So we put her on Philadelphia. That neck, this thick neck collar. That's Philadelphia. And we treated for 3 months. Today we remove. I said today we are going to remove your Philadelphia and you are going to, remove Philadelphia and you are going to turn your neck. Yeah, she was started crying. That is not possible. It's possible. We remove it. Yeah, but Lord and behold, that person is still living because we remove the Philadelphia and she turned her leg on the neck left, right, started crying. Even me, tears came from my eyes because it's cries of joy. Cries of joy. You can see. So magnet therapy is not limited to stroke. It's for so many diseases, but mostly bone, nerve, flesh, and then blood related, because you can actually use magnets to push blood into places. And also vascular necrosis, that is, all these sickle cell people, they have this hip problem. We have many of them here. We are partnering with Sickle Cell Organization of Nigeria. Our center is the center. There's no place in this country where they treat a vascular necrosis. We do it with magnets. So it's not only the stroke, it's everything. We do everything. Except here with our magnets, we do things except pregnancy, what else do you do that magnet? Malaria. You don't use magnet for malaria, and we don't use it for antenatal. We use our magnet for any other thing. So not only for stroke, to my sister, that's starting question. I can even read to you here what we do with our magnet. Then I'm coming, stroke, yes, arthritis, Parkinson's disease. Yeah, and then diabetes. you can use magnet to treat magnet. When somebody is diabetic, what's the cause of it? The insulin is not coming again from the pancreas. You can actually use magnet to pop up the pancreas to secrete the hormone insulin. Yes, we have even there's a magnet that's a bed for we call it diabetes bed. You wear it on your pancreas to pop up the pancreas to secrete insulin. Number problem, sleep disk. Yes, enlarged prostate, goiter, tumor, varicose vein, sciatica, ovarian cyst, products of the uterus. These are the things we do with magnets. Polio. These are the things we use magnet to treat. We use magnet for eye ailments. Eye ailments, glaucoma. We call something glaucoma, the ocular pressure in the eye. So all those ones we treat with magnets. Dementia. Then other neurological problems. Even mental disorder. We use magnet with it. Eye ailments, people sell these things and all that. These are the things. Then cerebral palsy. We use magnets for the children with cerebral palsy. So these are the things we do with magnets, not only stroke. Yes. After I answer your question.
Wonderful, sir. Wonderful. I believe you.
What are the,
more
I
than
want to
answered.
hear from the person that asked this question. Have I answered a question
Okay,
or
sorry.
any question? Huh?
Yes, sir.
Okay. I'm happy.
Great,
I want
sir.
to hear
Thank
more
you.
questions, no?
Yes, we're
More
going to
questions,
take more
please.
questions. Yes, no problem, sir. So we we have a few people who had raised their hands earlier, and we will be having them. So I think next we have the person whose name is Vivian. Vivian had been raising her hand for quite a while. If she is available, if she is present, please, Madam Vivian, please come forward with your question. Is she here?
Yes. Good evening, all. Good
Okay.
evening, sir.
Good evening.
Thank you so much for this wonderful lecture. Well, I would say it's a lecture. And what I believe in this life, if the right questions is not asked and the right answer will not be given, I'm so happy that I'm joining this group to hear this wonderful words. So my question goes like this, because I've been having lectures in naturopathic classes, and we are told that what natural herbs do is it takes care of ailments. It doesn't suppress. So I hear you say in one of your teachings here that if you're like a stroke, we are talking about stroke now, that a stroke person, a patient, don't stop your medication. So are you not saying that as a stroke person that the cure cannot be taken care of completely with natural herbs? That's my number one question. Then the number two question was, what are your advice for a genetic people about this stroke, because it is in their bloodline? That is number two. Then number three has been answered, which I think that was the question now. But I'm asking, is there any side effect on this magnet treatment? Is there any side effect? And another question there is that, do you like distribute it to your students who requested for it, or is it only in your hospital that this treatment is being taken care of? Sorry, and the third one, the last one is, do you send the people that do program in your school to any practical center, or do you have a center where you send them so that they can be fortified to the standard of the school? Thank you, sir.
Thank you very much. Okay. Now, I'm going to start from the back. That is the description of our magnet to students. Yes, our college is new. We're just graduating our students. So we expect our students to have learned after learning, after they have graduated, you want them also to to have experience. Yes, of course, we are going to start to give magnets to sell magnets to our students. If you don't sell, you tell somebody and you don't give tools to work. God will punish you now for that. So somebody learn something from your place. Well, you have paid me okay, you are telling somebody to go and eat. You don't give food. Is that not the same? So very soon, we're going to be distributing magnets to people they can buy to start their work. But me, I'm one person that wants somebody to learn properly before that person starts to do the work, so that that person does not go to injure people or kill people. You know what I mean? So anybody that fits in magnet therapy, yes, if that they have got enough experience, we'll give magnets for them to work. It's just like giving needle to nurses. You can actually buy your needle and syringe outside. So of course, you give, you sell to them. Then magnet is a natural therapy. My sister, it does not have. I will tell you, side effects. We have negative side effects. We have positive side effects. So magnet has positive side effects. Number one, don't misunderstand me. If you start to use magnet for certain things, you say A is troubling you. You just find that by the time you start to use magnet, what you didn't even say that a problem that you been having before and you didn't even mention. You just see that just thing goes. That's the side effect. You can reduce. So that's positive side effect. Magnet is thoroughly and entirely a natural way to treat patients. Like I said to you before, I said our body is magnetic in nature. All cells of our body, as you are sitting there or standing, I didn't see you, but I'm sure you are sitting. As you are there in that room, you are a hall or anywhere, you are in magnet. You have magnetic, magnetic this thing, wave. But even by breathing in, everything that you are doing is magnetic. So, my sister, no any side effect in magnet. The only side effect I told you is what I've said, that you are having positive side effects. No, not negative, that will trouble you or you do you any harm. It will increase the potency. It will increase your vibrative frequency. It will even feel that you don't stay. And don't see the magnet we use, we outlive you. The magnet I'm using now, the magnet I've been using since the time I started, are still with me. They don't lose their magnetism. They are still there permanently as permanent magnets. So no side effects. Then we have to go. I don't know the third one, my sister. Can you repeat?
Yes, I'm here. I said
Which
in
one you
our
about that? Side effect. Then the third one.
yes, the third one is the one I want to say now. I said in our naturopathic class, we have taught that when it comes to illness, the natural herbs takes care of it. It doesn't subside it. So now in your teaching, you said if you are having stroke, maybe when the stroke has left you for a while, don't stop taking your drugs. Are you saying now that my question now comes, are you saying that through natural things that the stroke cannot be cured completely, or the illness, let me just use, yes, cannot be cured completely? You stay out of the medication that you're using. Yes, sir. That's what my question is.
You misunderstood me. Yeah, I'm happy you had that question. You misunderstood me. You know, when somebody suffers a stroke, what is stroke? Stroke is as a sort of certain things. I'm talking about the positive factors, the causes of the stroke. That's why I said, if you are hypertensive, use your medicine. If you are diabetic, use your medicine. if you are, I mean, that's what I said. I'm going to say that for stroke, that you treat, once you treat, all these ailments, the factors that contributed to having this stroke, you don't have problem. Anybody that you treat with magnet, like for stroke, like stroke, other things like I've mentioned, they don't, I mean, no any relapse. They get better and they get well. What I'm saying is the causative factors, diabetes, hypertension, what's the other thing that is high cholesterol, and if you are HIV positive, people with we have seen nowadays we have so many people with HIV, positive that are going bad, they have developed AIDS. They also suffer, stroke. So that if they're having medicine, if they use their medicine on time and regularly, they will not have stroke. That's what I mean. I didn't say that once you are treated with stroke, then you have to use it for life. No, I didn't say that. Only thing I can advise to you for life is that magnetize water. By the time you have stroke and you get better, you encourage them to buy magnet for water, and you advise them also to buy magnet for oil. By the time you massage that side with oil, so it will get better. Not that I'm saying that you have to continue to use your medicine. I'm saying you have to use your medicine for hypertension, for diabetes, and for other things if you are still having them. I hope I understand. I hope you understand.
Yes, sir. Thanks
You
so
understand?
much.
If you don't understand, please ask more. I'm ready to answer any question.
No, is well understood. Then what is your advice for people that has this genetic, they know that this is in their bloodline? So what is your advice in the way they will carry themselves to avoid this stroke now? Because that's what
Thank
they
you.
call genetic is. Yes, sir.
Yes,
Thank you.
yes, that is in the body. That is, that it has run in the family for a period of time. There's a saying that if your mother has stroke or mother suffers stroke, if you are not careful, you also may suffer it. Not that stroke is hereditary. What is hereditary there is your high blood pressure. High blood pressure is hereditary. Sometimes diabetes also is hereditary. If your mother is diabetic, you may likely have diabetes. And I know a woman with 5 children, 4 of them are diabetic, except 1. So my advice to anybody that okay, my father has suffered stroke. For me not to suffer stroke, you check yourself regularly, your BP, your diabetes level, your sugar level, you know what I mean, and other things. You have to also diet. Because diet also contributes to what we are talking about. If your father or mother has suffered stroke before, better you have to be very careful with what you eat. One thing that I know I tell people, you have to bring down your cholesterol level. Diet is very important. Cholesterol level, if your cholesterol is okay, you don't have stroke. If your cholesterol is okay, many of these problems you will not have. So you have to be careful. That's my advice. You have to be careful. Diet, ailment, whatever ailment you have, treat it. Anything you think you do, treat it so that you don't suffer what your mother suffer or your father suffer. That's my advice to anybody. Because, that's what the question you asked just now is what many people are asking. When they come here, doctor, what can I do? See my mother, see my father, what can I do for me not to have it? We normally advise them. You too, how your father suffers stroke. Don't take what your father is taking. Control your diet. Obesity also is a factor. Slim down. Don't eat food that will make you, and then you have to do lifestyle changes. So lifestyle changes, and be positive about life. That's number one. Be positive about life. So that's my advice to anybody. Parents have suffered something. and you want to avoid doing the same, performing the same, having the same field. That's just it. I hope I answered your question. Hello?
Yes, sir. Thank you so much. Thank you so much.
Are you satisfied?
Thank you
Yes,
Because
very
sir.
I want
much,
to
sir.
satisfy anybody that asked question. No, I want to satisfy that person. I hope I satisfy your, satisfy you.
He's okay, sir. We have a few more people who want to ask questions, and time is running late. So we'll just pivot to the next person. We have God Gift Ndubusi who has a question. Please, Mr. God Gift, proceed with your question if you are present.
No, good evening, everyone. Sorry, I think I made a mistake. I don't have a question. I'm actually enjoying this session. Thank you, sir, so much. I really enjoyed today's lecture. I really enjoyed
Thank you
it.
very
Okay,
much.
fine. My question is this. Please, can we get the recording of today's session? I want to watch it again. It's a lot of information, to grasp within 2 hours. I want to sit down and really internalize everything our prof said. Today's session it's like the best so far. So I don't know, please.
The recordings will be made available. However, there are certain conditions, but we will announce this on Friday at the end of the final session. So if you stay with us till then, we will be able to release that information to you. So with that, so we'll move forward to the next person, who is Oge, that has a question.
Okay. Thank you, Prof. Thank you for this wonderful exhibition. I am an online student. I have my friends here with me in the class, in the workshop, and we are from Port Harcourt. And we have been with the school for 2 years. It's all theory. And it's really very, very challenging for us when it comes to practical because we don't have a means, you know, tangible means of practical, and it becomes very, very challenging for us. So, how is this magnetic medicine going to reach people in Port Harcourt? That is number one, because it is a rare cause, it's a rare practice, and where you have um someone that is seen in the midst of blind people, the person becomes a king. So how is this knowledge, how is this practice going to reach people in Port Harcourt so that we will also benefit and people around us will also benefit? That is number one question. Then number two question is, I have um, been with people that mostly suffer from hypertension or all this diabetes and all of that, and you see them because of so much fear that the medicine or practitioners have installed in them. I want to know, because when you bring like natural medicine to them, introduce natural medicine to them, they are so afraid because they tell you, no, I cannot stay away from the drugs they gave me in the hospital. How are you going to incorporate orthodox medicine and natural medicine, and trying to convince them that they have to do away with their orthodox medicine because it's not, or their drugs because it's not actually not helping them? How are you going to see to that? Yeah, are they going to be taking their orthodox medicine and also taking their natural medicine? How are you going to do that? Please, doctor, I really want to know. Thank you very much, sir.
Yes, I'm happy to ask this, for this question you asked. Number one, I'm surprised that magnet therapy has it can reach and no enough practicals. We send people for practical. We have students that have even graduated from for magnet therapy, they were sent to us here. So so any person that wants to study magnet therapy, you have to come to where they practice magnet therapy, and that is where we are. We have students, even some of them we are even employed because when they study magnet therapy, because if you want to study magnet therapy in Port Harcourt, there's no way we can bring magnet therapy to you there. Yes, you can be an online student, but you still have to, because magnet therapy is capital oriented. You have to see. You have to see what you practice, not that theory. Theory, okay, but you can't practice magnets without. So you that will come from there to come. You have to. Me, I went to India to study magnet therapy. India, more than 10,000 kilometers away from here. So I went even 12,000 kilometers away from here because I needed it. So anybody within Nigeria have to do magnet therapy. I don't know anywhere where I can send somebody to go and do practicals. Of course, people are practicing naturopathy, you can send people there. People are doing homeopathic medicine, you can send people there. But for magnet therapy, I know of myself only. And I know only of Cyrillic. So anybody want to study magnet therapy, and that person really meant to study magnet therapy, has to find time to come here and spend some time for you to have practical. That's number one. And to reach Port Harcourt, online students, are you a magnet therapy student, madam?
No, not yet, Prof. No,
Okay.
not yet, Prof.
Okay.
Process. We have been going from one course. We started from public health and homeopathy. We entered into chiropractic, from chiropractic to acupuncture, from acupuncture to physical therapy. So we have been transiting from one course to another.
Okay. But are you enjoying the courses you are doing?
Of course, very well. If not, how can we be going from one course to another if we are not getting what we are there for? Yes, of course, Prof.
I'm happy about that, madam. I'm happy. But for magnet therapy, anyway, by the time our book come out, we have books. As I said, by the time new books come out on magnet therapy, you will read, you will learn. But I still advise you, if not more than for 2 or 3 months, come. If you really want to know magnet therapy, you get experience tired here because you see cases every day. You'll be tired of patients. So it's better if not to study magnet therapy. Magnet therapy is different from naturopathy. Naturopathy you can study, but it's still also you need to do practicals because medicine itself is practical oriented. Then for other things you are asking, if anybody has any problem with health, we have like blood pressure. We have magnetic belt that you put on your right hand to bring down blood pressure. We have homeopathic medicine also, to bring down blood pressure. Then, how to convince a patient? My sister, you need not to convince anybody. Your work will convince. Yes, I've told you about something. Now, our patients, medical practitioner, orthodox medical, when I say medical practitioner, we are all medical practitioners. But orthodox medical practitioners, I have them as my patients. I have their parents, I have their wives, I have them, I have their friends. I have a doctor in the good area. He comes to me, his friends are coming to me for lumbar scoliosis. Nobody, except operation, surgery, nobody can treat lumbar scoliosis. And my sister ask them, what is the rate of recovery? They tell you 50% chance. Many people have gone for surgery for back pain and they are on wheelchair. But for magnet therapy, you can't be on wheelchair. And your back, the bone in your back will go back and you walk normally like anybody. So we have all that to do. Homeopathic medicine are there for you to take. So you don't need to convince anybody, my sister. If you convince anybody, if you do well, we are not convincing anybody. And people are rushing. If you come to Cyrillic in the morning, you'll be shocked. In the morning, you'll be shocked that people coming to sick. Even among them, doctors' wives. doctor's mother. My sister, don't convince anybody. If you are doing your thing properly, you will do it well. I mean, if you do it well, people see, doctor will talk about me outside. My parents will come and tell me, have you seen that? Because they're happy. So action is that, I mean, than boys. So if you do your things properly, even if anybody talk about you, your mama, one mama went to general hospital in the Bode here. Not for anything, no, she just went to give somebody. And the doctor saw, mama, so she had this magnetic band for high blood pressure in her hand. She didn't go for consultation, just to give somebody that gave birth in the hospital. The doctor wanted to make fun of it. So, mama, you are part of them that are deceiving. Mama said that she disgraced this doctor. People are begging her. Doctor, don't disgrace her. I mean, mama, don't disgrace our doctor. You people, you useless people. Since I started using this band, my body has been okay. My TB has gone down. You want to kill me with all the drugs you have been giving me? Go to him and learn. You're talking rubbish. And she started cursing them. They beg this mama. Because this is a man, somebody that has been on drugs for years. In Yoruba land, we have this band they call Bekude. That is something that kills death. That magnetic belt for BP is called Bekude. So something that can take death because BP. So you can see that that's a patient that fights a doctor. I sent a woman for scan. One doctor said nonsense. What are they giving me for this thing? Go and do operation. She came to tell me because our friends have used it. That's why she came. The doctor, please, I came for scan. Don't tell me what to do. You shut up your mouth. I'm going to tell this doctor what you are saying. Started begging. So don't tell him. You can see that. So I need not beg anybody. Our people are the one fighting for us. But today nobody is even talking. I'm happy. Thank you very much.
Thank you, Prof.
Have you learned anything from what I said?
Oh, very sure. Very well.
Okay, thank you.
Very well. Thank you so much.
Thank you very much. So we will take the question from Uchenna, who had been raising their hand for a while. Let's proceed. It's Mr. Uchenna here. If they are not present, then we can go to Madam Favor. She has a question.
Thank you very much, Prof, for this wonderful section. I'm really excited. I'm excited. I'm more excited and thankful to God who directed me into this school. I was among the people that graduated last month.
Wow, thank God.
So, sir, many of the questions I wanted to ask has been answered, but there's this one that I want to ask.
Ask.
Could somebody the person was not hypertensive, just accident, he had an accident, he was attacked by whole lumps, and then developed cerebral aneurysm. Could this thing be treated with magnetic therapy?
That's all?
I don't know whether, yes, I want to know whether it could be treated.
It's possible. Possible, very, very possible. Even magnet is the best for it. Magnet therapy is the best. That person you treat, you do normal size, you see when you treat magnet, you can place magnet in the body and not where the problem is, and it will reach.
Okay.
But also we call something site, therapy on the side. That's the way you put the magnet, you manipulate it that it works to the place. And then we have this magnetized water. Magnetized water, we call it water of life. See, when you take magnetized water, this water can treat every sickness, every disease, and every ailment, the lack of magnetic vibrating frequency in the body. So by the time you start to apply magnet, magnet itself, the body itself, because by applying magnet into the body, anywhere in the body, that place is, the body itself will fight disease. That these people with cerebral palsy, people with cerebral palsy, children, madam.
I'm here. I'm with you, sir.
I'm asking you. Do you know that children with cerebral palsy?
Yes, sir. Yes, Prof.
There's no way you can treat them. It takes time. Do you know of epilepsy?
Yes, Prof.
We treat with magnets.
It can still be treated.
We have a chamber we call a magnetic chamber. That's why we treat their head for certain
even
periods.
psychosis.
Yes, madam. We are treated
Wow.
as mad people. But the problem I have, I don't want people to label this a mad people hospital. That's why we don't take them. I've seen cases of mad people. We put them under this magnet. The magnet will just, it will. Like I said, it will. It will restore the vibrating frequency. When somebody gets mad, it is something is wrong with that person's brain. So by applying magnet or putting his head in the magnetic chamber, you'll be shocked. But I don't want people to, because mad people, by the time you are bringing them, people will say, no, that place is for mad people. I'm not going there. You can, the way people will think. That's why I just limited myself to people I know very well. So there's anything nerve, brain, anything. It's not what magnet will work for. So for your question, what you ask for, magnet can do it easily.
Thank you very much, sir.
But I've not seen anybody from the East studying magnet therapy.
Yes, it's just the time when we were doing our course now in naturopathy, we were taught, and then as we came for the convocation, we were opportune to come to the hospital, the clinic, and saw the people that were being treated. And then this lecture now is even making it more clearer.
Okay.
So we still have the intention of going further to know more about it.
Okay. You are welcome, madam, to magnet therapy. You enjoy it.
Right, sir.
Any other question?
So maybe we can go for the next person. I'm not sure who is the next person on the list. I believe the next person is Madam Downsy, is the next name. Is he available?
Hello?
If Ms. Downsy is not here, we can... Yes, sir, no problem. So, just a minute, sir. So, Madam... So, Madam Akudike can proceed with the question, please. Akudike Agnes, if she's available. Okay. If Akudike Agnes is not available, then I believe there's Mr. Godgift who said he had a question.
Let me ask.
Please, I'm available. Good evening, Prof. Good evening, sir.
Welcome.
Thank you. I'm so excited on this topic of the day. I've even applied for massage and acupuncture lectures anytime from now. I think I've applied and I will start from there because I would like to know more about it. So there's this patient that they brought that has a stroke for the past 10 good years. They came yesterday, but I was just doubting if it can be revised with magnetic therapy. Can it be possible to use magnets on that patient that has been on stroke for the past 10 years? Secondly,
yes,
my other question was, then that was yesterday. I wanted to ask the question, but I wasn't opportune because network knocked me off. If there is a means of maybe this ICU, and I mean something that can take somebody to ICU, intensive care unit. Can
Yes.
acupuncture, yes, can this take care of it? Just we prevent it before time. The patient will have crisis of taking the person to ICU, intensive care unit. Thank you.
Well, I'm not clear of your question because for somebody to be taken to intensive care unit, person must have covered certain ailments. Now, I want to know, you said before that person has been taken to ICU, what can be done to bring that person out of ICU? That was the question you asked. If that's the question you asked, what is the problem? What's that person's problem?
The person had stroke for the first time and it was handled. Then the second time, after 2-3 years, the person had another stroke, which lead the person to ICU, intensive care unit.
Okay, maybe
So
okay, maybe that person has a hemorrhagic so because for you to go to intensive, ICU, maybe that person is in a coma.
yes,
So
the
if
person was
the
on.
person is in a coma, let them when they finish when they use oxygen and all that on that patient, and that person come around, then you can use magnet on that person. But somebody in ICU, it will be difficult to give magnet therapy for somebody in ICU because mostly for people to get, which means somebody that is taken for ICU must have, a serious problem. And like I said, maybe that person is in a coma. So only magnet, or partner medicine you can give to somebody in ICU that can actually help, not magnet therapy. Because for magnet therapy, you have to apply on part of the body, the limb and all that. But for somebody in ICU, that person cannot do anything. But if you're able to put some opathic medicine into the mouth of that person, it will help. Are you
Okay.
okay?
I believe,
Okay,
Madam.
thank you very much. Thank you so much.
Are
Thank
you
you.
okay with that?
Yeah,
With the answer? Are
Yes,
you
I'm
okay?
okay. Yes, I'm okay. If the person is
Okay, thank
conscious,
you very
then
much.
the magnetic therapy will take care. But if the person is unconscious and is on coma, there's no need, taking that person to. For the magnetic therapy, if the person is very, very
Mm,
unconscious and is on coma, you said that there's
mm,
no need using the magnetic therapy on the patient. That's
mm,
that's what I
mm.
understand on your
Yes.
answer to my question.
Mm.
Thank you.
Thank you.
Thank you. Thank
Any
you.
other question?
Yes, yeah, good evening, sir.
Good evening. No.
Yes, okay. This is my question. There's a patient. He had stroke in 2022 ending. So luckily for him, the thing didn't affect his hand, his leg. No, he didn't. He can walk, he can stand, he can move, he can do everything. But he had stroke. He was forgetting stuff and all that. But luckily for him, we were able to manage him and all that. But recently, I think around last year, he had another episode, and this time around, it was not really good, right? So this one was not really good, and right now, it has gotten so bad that he can't hold pee. He urinates uncontrollably on his own. That's the challenge now. So that's just the thing. So right now, he can't just hold pee. So
You
he
cannot
urinates on his own. So
hold the
he can't even
clean.
hold urine. He pissed on himself, like
Okay,
I don't
okay, okay.
know.
Yes.
Yeah, he used to piss on himself, so he can't hold it and all. And I remember on Monday I asked the question concerning it. The person that handled this was like, "Oh, that probably there's a part of the brain. Probably there's a part of the brain that affects the muscle that has to do with holding urine that was affected and all." So I don't know if this magnetic therapy can actually correct this type of thing, because that's the only challenge now. He can stand, he can move, he can do other things, but just that urination. So he's always on pad. The caregiver is stressed. Is right now the caregiver self is not feeling well because the
Mhm.
stress is already becoming too much, and he's in my state, emo state. So it's just a lot. So I don't know. I
Thank
just
you.
don't know how if yeah.
See, thank you very much.
Yeah.
Now, like I've said earlier, when somebody suffers stroke, all organs of the body, all things of the body will collapse. You know, and normally have what you are talking. Normally have it. Normally, we pass catheter for the you to go inside the catheter. But uh, by the time if you apply magnet, if but now you are away from us. If to say you are here, that is small thing. You just put the head in the chamber, magnet chamber, to correct, to actually correct the functions of the because all functions is from our brain. As I'm sitting, I'm talking, it's my brain. I'm holding my hand up, it's my brain. The P we are talking about, the identification we are talking about, everything is from the brain. So by the time we apply magnet to that person, yes, but we are far away. How do you help? And how can you help?
They can come to that place that
That was I'm
Okay,
saying.
is it possible for us to come to Jebo Day?
My
Like
brother,
how
people
long?
come
Yeah,
from
I want to know. Okay, all right.
I mean
Okay.
people come from all over this country and even beyond. I've gotten patients from Cameroon, we have gotten patients from Benin Republic, we have patients from Togo, even from Ghana I have patients. So people are coming. So, and not to talk about within Nigeria, I have a lot of patients from Kano, from Kaduna, even from the East, we have patients from Benin. I have so many, you know. So, I don't know how
All right.
long it will take for a patient to be okay. No doctor can actually tell you that within so time. But that person you're talking about, is he conscious?
Yes, he's conscious. He's conscious. He's like before, before, he was forgetting stuff, but right now he has come back. He can remember stuff. Every other thing is corrected. It's just this urination that is just the issue now.
Control
Yeah,
the bladder.
yeah, bladder.
Irritated. Yeah. Well, can't you try homeopathic medicine for that person? I can do
He
something
said,
for you.
okay,
Can't you
okay.
prepare? And another thing I want to ask you: that person, are you sure it's not? He doesn't have. It's not. He doesn't have prostate. Because if you have prostate,
No,
you urinate frequently because of the blockage. The urine will come little by little. There won't be easy flow of urine. So it becomes that person to go to toilet frequently. Are you sure that person is not, doesn't have, it's a man, Abi?
yeah, he's a man. We've done
Are you
tests for
sure?
prostate, and it showed that he doesn't have it. We've done that prostate. That was the first thing we did actually.
Okay. Now let me do something for you. If it's only that thing you are having, like you said now, you said everything's okay. Only this urination that uncontrollable, Abi.
Yes.
Let me do something for you. You after this, you just in touch with Dr. Daniel, and I will prepare
Okay.
one medicine for you, party medicine for you. Then I'm
Okay.
free of charge.
Oh, thank you,
The only,
sir.
the
God
only
bless
thing
you, sir.
you pay when you get to Imo State, you pay for the transport. But I don't know
All right, sir.
Imo State. We have to carry with EMS. Imo State, where is Imo State? Oweri or where?
Owerri, yeah, Owerri.
Okay, I'll ask from the body. Maybe I know of Asaba, Benin, Port Harcourt. You send medicine to those places. But I don't know of Oweri. So if there's no place, you can send through EMS. But EMS will take time, maybe about 7 days. At least EMS is just so post office courier service. You normally use it to send medicine. I can prepare something for you free of charge that you can give to that person that will stop, this uncontrollable flow of urine.
Uh,
So if you don't
okay, sir.
mind,
Yeah, I don't mind. Thank you, sir. I will appreciate that. And for delivery, I was thinking all these like God is good, all this JIG and all. doesn't work. Because that's what me I do use to send all these supplements down there. I use all these GIG. I
That's
don't know
from
if
Lagos.
it's possible.
Okay, I'll ask. That's from Lagos. You know all this. They
Okay,
start from
okay.
Yaba or from Imaltu, but from Jabode here, sometimes they are full. But I know Asaba. We send things to Asaba easily, to Benin, to Wari, to I think Aba also. I don't know, but
Yeah, yeah, yeah.
I will see. But I will ask questions. I will ask. But for
Okay,
to
then.
give something to I mean for unquestionable unit, I'll give something to you free of charge. But what we inquire
All
is
right.
how to send it.
Okay.
So I will need
I'll
inquiry about it, how to send it to you. Maybe from Ibadan or from
okay.
Djibouti.
Or if possible, Seth, if you can just do from Ijebuode to Lagos, because I'm in Lagos, I can do from Lagos down there to him, because all these GIG and all, they are
It's
plenty
easy
here.
to do something for today we send things to Lagos every day. I can really send things to Lagos or get a new garage. I do that.
Okay, no problem.
Just
Yes,
a new
yes,
garage to
yes.
do. Uh-huh.
Okay,
So if you have
yes, yeah.
anybody, I can send it to, and that person will help you to send it to your place.
Okay, I'll talk to Dr. Daniel. So we'll talk about that
So I'll
arrangement.
send it.
So thank
It's
you
free
very
of
much, sir.
charge.
God bless you, sir. Thank you. God bless you. I appreciate it, sir. Thank you.
Another one, another question.
Yes, sir. I have a question.
We can move to the next question, please. Miss Joy. I'd been
Okay.
raising her hand earlier.
Okay, thank you so much, sir. Thank you so much, sir. Thank you so much. I must
Yeah.
say that today's lecture.
Also, I'm very sorry to interrupt you, madam. Please hold on a minute. Please, let us limit our questions to the topic of discussion today. For those who wish to order or discuss purchasing remedies or getting remedies for themselves, these are discussions to be had later, not for tonight. Please, thank you very much.
Okay, can I even contact you behind the scenes and
Yes,
let
we can
the
contact
or the
the
phone number?
college. We will provide the email. They can approach us there and we can discuss that. But that is not the discussion for tonight. It's discussion for after. Okay.
Okay, let that person
Sir.
ask a question.
Okay, sir. Thank you. So my question is this. Not really a question, but an observation. But before then,
Okay.
I must say that tonight's lecture has been impactful. I'm excited. I'm also in Port Harcourt, just like Madam Oge. We are all here. How we wish that we could be in Ijebode so that we can see all these things done live. But all the same, in the future, taking up this magnetic therapy. Then, where I'm a naturopathy PGD student currently, and I'm doing my IT here in Port at an acupuncture center, and the center is doing well. But there's this patient that they have currently. And when I started the program, I was thinking that she's a stroke survivor, you know. Not until today, when the doctor was having an acupuncture section with her, you know, he said that that she doesn't have stroke, you know. Meanwhile, all the while I was thinking that it's partial stroke survivor because one of it's just hemiplegic. One side of her hand and leg, even her speech is impaired anyways. Even the thing affected one of her eyes. So all the while I was thinking it's a stroke survivor, not until today. So after he carried out a sharp acupuncture on him. So after the session, I had to go to her folder. I said, let me know what is really the case. Then I found out that she was diagnosed of neuralgia. So her gait is the type that she claps one of the legs and all that. So I want to know. I needed a little. Do neuralgia and this stroke have similar
Yeah, and
presentation?
neuralgia is a nerve problem. Hello.
Yes, I can hear you.
So you want to ask maybe Magna can do it.
Yes, from today's lecture, I've come to know that magnet can handle it.
You can
Yes,
do it, yes,
but
easily.
my confusion is the symptoms and the presentation is the same. So do they have similar symptoms? That's the area I needed clarification on. Thank you.
Mm. Anyway, here also, when people sometimes they will say somebody has stroke. I mean, that person will present like symptoms of stroke. You know, when you say somebody has stroke, normally it's usually a part of a half part of the body. We call her. So, but sometimes it is not stroke because somebody with stroke, there are ways you can know if it is actually stroke. Some people, it may be, I mean, as a result of nerve damage. Sometimes also it may be as a result of some, like neurology you are talking about. So you have to, I mean, you have to put, you have to treat that person with a magnet, and probably also you give magnetized water, and also I mean, you apply magnetized oil to enliven the nerve. You not be shocked that this person that you think is has stroke or maybe whatever, I mean, is not able to move. He move, not able to raise the leg. You raise the leg. Sometimes sciatica. This to sciatica also, it will look like as if you're having stroke. I mean, that person will be dragging the feet. I mean, so many like that. We have patients like that. So if that is what that person is presenting, of
All
course
these things
you
not
can
true.
use magnet to treat that person. So, but the question is, how do you get this magnet? But I mean, are you a magnetotherapy? Have you been done to treat with magnet, or you want to send the patient down to us to help you, or what do you want?
Maybe they say they should talk about these things later.
Eh?
Okay. Not really that I want to send the patient. It's just a little clarification that I needed here, and
Okay.
you have
And if
you
you
have
want also, we can send you some. I mean, maybe behind the scenes we can talk about that one. So maybe you can meet Dr. Daniel, talk to him. You will tell me, and we see what we can do. Because
okay.
we are
Thank
in
you.
it together. Your success is my success.
Thank
Are
you
you a
very
student of
much,
our
Prof.
college?
Yes, sir. I'm
Oh,
currently doing PGD in naturopathy.
oh, no problem. Your success is my success. Me, I mean, my all our students, anybody that's studying, in our college must be a successful person. So everything in our power we have to do to make that practitioner a good practitioner and successful. So I mean, I can go out of my way to help you to do things like that. Mm. But still, meet Dr. Daniel, you can talk to him, and or you can take my number and let us talk and see what you can do. But if I'm interested in magnet therapy, better come and study it. It's better. You can solve so many problems with magnet therapy. I mean, so many problems. Eh? Problem that you think that you cannot. I mean, people think that you cannot do. You do with magnet if it's properly studied and you know it. Mm. Thank you.
Thank you, sir.
The next question.
Good evening,
Okay.
everyone.
Thank you very much, sir.
Mm.
Hello, good evening, everyone.
Yeah, good evening.
Good evening, Prof.
How are you, my brother?
I'm doing just fine. I was called upon the other time, but I was still on the road, rush hastening to the house. Now I'm in the house. So some of my questions have been answered, but yet I have two questions for you. By the
Okay.
way, the lecture was very interesting. It was interesting, and I really thank God that I didn't miss out of the lesson. So the first question I want to find out, I want to ask is, can the use of this magnet take care of myoma and retroviral disease? Can it take care of myoma and retroviral disease? And the second question is, how much is this magnet, and how soon can someone get it if payment is made?
Thank you. Myoma is out of the way for magnet therapy, but homeopathic medicine can do that. But then to other I don't want to do something. Like I said to before, myoma is out of it, but homeopathic medicine can help you with myoma. But how to get magnets? One thing I'm scared of is that I don't want magnet to get into the hands of somebody who cannot use it properly, because you have to be a magnetotherapy for you to use magnet. So that's my fear. You know why? Magnet may look simple, but it can easily kill if not properly put or not properly applied. Yes, it can kill. There are certain parts of the body where you don't put magnet, and due to the condition of that person. You understand? So, but certain things like myoma and other things can be treated with homeopathic medicine. So easily with homeopathic medicine, but not with magnet. Magnet can take care of tumor, can take care of brain tumor, can take care of any other thing, another swelling, but not myoma.
Okay, what about retroviral disease?
No magnet. Use homeopathic medicine for that one. All those ones we are talking about, they are not that normal. Like I said to you, magnet is very good for with a nerve problem, bone problem, swelling, and then gout, arthritis, and all that. Yes, magnet. Basically, nerve and bone, and other things. You can do that, but not like a tumor. Not like a fibroid, myoma, and all that. So all those things you have spoken about are for homeopathic medicine. And me, I normally prepare homeopathic medicine for somebody. If I see the test results, you send it to me, and prepare for you and give to people. Now, many of the homeopaths that we have, they normally, because I have remedies, and they know that I have these remedies. I have over 6,000 remedies. I practice classical homeopathic medicine, not the electronic type. And I have remedies that are brought in from India. I can help you to, each time you have any challenges, tell me, send the result to me. That's what I do for too many people. So send the test result to me. I will prepare medicine for you. I send it to you. I can even send to you free of charge. Go and use. If it works for that person, definitely it will work. Then if you ask for more, then I can take money. But initially, if you are a student or somebody associated with our college, I can do for you, like I said to the other man, for you just to pay for the transport. So I want to start to do that for our own students, challenges. So to make them to have success, to be successful in their practice. So that's it. One is not everything. So I hope I've answered your question.
Yes, sir. Please, one more question, sir. Is this magnet a course in the school? Is this magnet treated as a course in the school? Is it a course?
Yes, yeah. You said, are you our student?
Intending to.
Okay. Magnet therapy is one of our courses. We have even those who graduated recently. We have some about 2 or 3 students that study magnet therapy, and they are doing well. Even 2 of them we have employed.
Okay. Like how long is this training? How long is the course?
Ask the registrar. Dr. Omisande is here. He's listening. Get in touch with him. He will tell you the registrar. Me, I don't know anything about that one. He's the one doing everything.
Okay.
I'm just the provost, and he is the one running the college 100%. And he's doing it well. Just get in touch with him. He will tell you what to do.
I wish, sir.
So in myoma and other things we are talking about, if you have anything, just let me have it. Let me see the result. I'll get you medicine. You just pay for the transport. That's all.
Okay, like how long will it take to flush the myoma?
My brother, nobody can tell you that I have there's one medicine, Ashoka is there. I mean, you displayed it. It's an Indian medicine for myoma, for ovarian cyst, for to clear the blood fallopian tube, endometriosis. I mean, let him go back to show you. You will see it. Please wait a
Okay.
minute. Wait a minute. Aha. Can you see it? Have you seen the Ashoka Indian about product? You have seen it?
Yes, sir.
Have you seen it on the screen?
Yes, I'm seeing it.
Aha. You can see female infertility. So that's another one we have to eat. For that one can take care of endometriosis, take care of blood fallopian tube. If you had another one to this one, to take care of myoma, instancer, and also it helps also with hormonal imbalance. Yes, for women.
Okay.
And we have seen with women, many women by the time they use this medicine, they get pregnant immediately. Yes.
How much is it?
15,000.
Okay,
the one you are saying is 15,000. Then on medicine we have to use for myoma is 10,000. That's 25,000 for both.
So, like, how long? What's going to be the impact of this? Is
My
it
brother,
one of something?
no doctor can tell you. See, that's one thing I want to warn people for. See, don't tell patient that patient you are going to have give medicine to. See, the body chemistry of each patient is different. You can use this medicine for somebody now, and within 2-3 weeks, you eradicate the myoma or fibro, whatever you want to eradicate. And some you give this medicine to. They have to use about 2 or 3 or 4 for them to get the desired result. So what we say is that, well, let's use it. After they use, go for test. The test result or after each use will tell you maybe they need more or not. If I tell you now that you can use 10, 3, 4, 5, or 6 without seeing the result, if you can see the result, I won't tell you to use. But I normally tell you to, number 1, buy 2 first. After the 2, go and do your test. But don't be saying that I'm not the mistake. Nobody can say how it's mistake. Because if you continue to do that, if you tell patients that to take you to this thing, they'll make you become a liar. Yes, you become a liar. Because you tell somebody to take about 2-3 months, so after 2 months, nothing is done. And you become a liar. Better tell them, yes, and we don't know the time to everything will go, but just buy 2 first, then let us see. Let us see. You're not God.
Okay, sir. Thank you.
Okay, any other question? Although time is running late, but I'm not tired. I'm happy.
For now, I
Hello,
guess
sir.
blessing will
Thank
take
you very much,
blessing.
sir, for this wonderful discussion.
Thank you. My pleasure.
Hello, sir. Thank you very much, sir,
Thank you,
for
madam.
this wonderful session. Please, there's something I want to know. I don't know whether this magnet therapy is good for people with a malignant tumor, because there's this patient, she has cancer, and she's a stroke patient. And one of my patients, she has cancer. She's a stroke patient at the same time. So, can magnet therapy help her?
Yeah, for stroke, it can help her, but where does she have this malignant tumor?
Yeah, in the breast.
Breast.
Breast cancer.
Breast cancer, and
yes, sir.
Is the breast open?
No, it was open, but now healed. There's no open sore for now.
But the breast is still hard.
It's hard. There's a tumor.
Yeah, what I'm saying.
A kind of a lump, a little lump that is not.
That's what I'm saying. The breast is it open? It says it has healed up. Then it still does it have this tumor inside? They still swell. I mean, is it swollen? I mean, does it have this tumor inside?
Yes, sir.
Madam,
Yes, sir. Yes, sir.
you know what I will tell you about this one. It's hard to, it's very, very hard to, but you know what I do? I get process in it. Any patient with breast cancer that has become cancerous, like you said, malignant, tumor, just encourage them to cut off the breast.
Yeah.
See, if you go and sit down and actually think of it, the majority of them don't get well. They don't get better. Yes, it's my feeling. What I tell them, I call them and tell them, please go and exercise this breast. But when they exercise it, the chances of living is there. Then you give them medicine. This medicine is very good for breast cancer. But let that person go and advise that person to cut off that breast. Yes, that person has chances of living. But if you continue to say you are giving medicine, so we have enough to see there, sister, you are not doing proper work. Anybody that comes here and I see that there is breast lump and the lump is still there, because it will metatize, it will spread to the body, and that person eventually, that person will die. Yes, but if you cut off the breast on time, it will not spread. There are medicine, there are homeopathic medicine you can use for breast cancer. I treat prostate cancer, breast cancer, cancer of the lung, cancer of the esophagus, cancer of the rectum easily with homeopathic medicine. So homeopathic medicine is very, very, very good. So I will encourage people that are in there to also study homeopathic medicine. Yes. So if I'm able to know, I can give you medicine that can do to that patient. I mean, after that person has cut off the breast, because if this is malignant, tell that person to cut off. Yes, that's what I do for them to live. If it is deny that is just there, not malignant, just a tumor. Yes, even there's medicine. But when it becomes malignant, no problem. If it's still tumor, you understand?
Okay, sir. Yes, sir. Thank you very much, sir. I understand. Thank you, sir. So, I appreciate, sir.
Other people that are taking care of people with breast cancer, please, I beg of you, please, don't take up breast cancer that is malignant. If you want to take it up, tell that person to first cut it off. Let them go and exercise the breast. After they exercise the breast, I'm just talking generally to many people, because many people are just doing yama there. Most of our people are doing bad job. I mean, once there's cancer in the breast, please have to be exercise. That person has chances of living with homeopathic medicine. There's homeopathic medicine that can take care of that easily. Prostate cancer, there's medicine that can take care of it. Cancer of the esophagus, cancer, there's medicine. But the number one thing is that it's cut off the breast. Thank you.
Thank you.
Hello, good evening, Prof. Good evening, sir.
Good evening.
Thank you very much for the class. Hello, good evening, sir.
Good evening.
Oh, thank you very much for the class. It was very insightful. I enjoyed every part of it and your question section too. I want to ask, please, which of your remedies can you recommend for someone with high cholesterol level? Please, sir.
Answer again, please.
Okay, sir. I'm asking that
So,
which of your remedies
the question again.
can you recommend for someone? Okay, I'm asking. I said, which of your remedies can you recommend for someone with high cholesterol level? Yes, sir.
Stamina Juna. To clear up cholesterol easily. High cholesterol.
Okay, sir. Thank you, sir.
Thank you. Please, Dr. Daniel.
Yes.
Dr.
I
Daniel.
guess that will be the end of the. Yeah, Dr. Daniel is not here. He's not here. I guess this will be the end of the session, the workshop. I guess
Thank
if
you
there
very
is
much.
another question, we'll on
Excuse
till
me, please.
tomorrow.
Can I just excuse me? I have an emergency. Please. They just called me now that I have to attend to an emergency. Please. Please.
Yes, so you can go. We are already done actually. We're already done. Well, thank you all for joining today's workshop, and thank you, Prof, as well for joining us today. I speak for everybody when I say that it was an amazing session today, and may God continue to bless you and help you in this your field. So tomorrow again we'll continue where we'll be having another speaker. And I hope everybody, I see everybody as well tomorrow. Okay?
Okay. Thank you.
Yeah. Good night, everybody. Good night.
Okay, thank you. Good
Okay.
night, everybody. Good
Good
night.
night, all.
Thank you.